Good afternoon, everyone. Appreciate you being on here today. I'm Lisa McCracken with Holleran. We have a nice group of attendees here today with us again. This is the 5th webinar in our Social Accountability webinar series, and at the end of today's webinar, I will talk about where we go from here and looking beyond some of the topics that we've discussed over the last several months. For those of you who have not been a part of these webinars in the past, we do have everyone muted from the telephone line. That's simply because of the large number of attendees that we have. But we do take a look at questions that you pose. So in your pane, you're able to submit questions throughout. We will likely address them toward the end unless I see there's a question that's very relevant to a particular slide or topic that we're on. So we'll definitely allow some time for some Q&A at the end. The other thing is we do archive all of these, so we have the PowerPoint and also the audio portion archived on our database, and you can see at the end of the session where Holleran's website is. So we have myself today, and then we also have Scott Miller from Garden Spot Village, and I'll introduce him when we transition to the provider part of today's session. So one thing I do want to give everyone a heads up about is I know we've had in some previous webinars some issues with a little floating black box, often on the right hand of the screen, and we've been aware of that as well. We've been in conversation with GoToMeeting about that, and it seems to be an issue with the latest version of Microsoft Office and GoToMeeting. So it's not unique to Holleran, and it's something that they're trying to fix and patch on their end. So just going to give you advance notice. If you see that, it may periodically pop up here and there. We apologize for that, and it seems to be connected with when I'm trying to control the screen. So, okay, so thank you again for being here today. Today's focus is on the role of partnerships in social accountability. And gosh, that's probably one of the most commonly used terms out there today, everything from talking about social accountability to healthcare reform and, government entities. It's all, doing things together collaboratively in partnerships, and it clearly has a role in social accountability. So, the purpose of my section of it is to give a general overview of how to think about partnerships, their role in social accountability, also how this does connect to some other aspects of healthcare reform and so forth, and also to get you thinking strategically about partnerships and not necessarily in the more is better category. I know sometimes we can get caught up in that a little bit. So after that, I will transition off to a highlight of Garden Spot Village, and we always find that, or we get feedback that it's really helpful to have some real provider examples as part of this. So, and then we'll roll back around and I'll talk again about Holleran's toolkit and the release of that, which is coming up next week, and get into a Q&A. So without further ado, that is me. Purpose of today's webinar, again, is to share with all of you the importance of community-level partnerships, to give you thoughts on how to best position yourself as partners. It's not as easy and simple as, oh, okay, I just think I want you, and as a partner, and we'll go out and make that happen. So obviously that's a simplified approach to it. But so we'll talk about that a little bit, and then to hear from a provider about their social accountability commitment, and then some examples that they have about some partnerships that they have fostered in their local community. Some of you who have seen me present on social accountability may have seen this before. I think I've used this article or this cartoon a couple times. And I actually found this about a year ago. There's a publication here in Central PA called the Central Penn Business Journal. And it stuck out to me simply because it clearly communicates in a pictorial way about partnerships. And it says, two nonprofits dealing with the recession and looking at each other and saying, hey, you know what, we're sort of heading in the same direction. Why don't we work together? The important thing to note about this is that obviously partnerships, can be informal and they can be formal. So, I may give examples of both, but I want to just communicate that when we're talking about partnerships, it doesn't always have to be like a formal arrangement where, finances are are exchanged, and maybe it's a dual reimbursement structure. You're doing some service and then your partner's doing another. So again, and a lot of the social accountability efforts, quite frankly, are not that. So I just thought that this was a neat cartoon that I wanted to show here. And I also wanted to highlight a specific white paper that we wrote, myself and Michelle Holleran. Oh my gosh, it was when they were still called ACOs, and how long ago was that? Maybe 2 years ago. And it's all about fostering strategic community partnerships. So I would encourage you to go and take a look at that white paper. You can find that on our website, and I believe on the Leading Age website as well. So that's something that certainly you could distribute throughout your organization to board members, whoever is most appropriate to take a look at that. This is a quote. I actually just saw this quote this past weekend at a board retreat that I participated in. And the quote was, "The time is always right to do what is right." And the reason I have this here is because, you know, as I talk about thinking strategically, and for those of you who in the future turn into our social accountability toolkit, talk a lot about being, you know, have a strategic approach to social accountability, being very disciplined about it. And while we think that is very important, one of the things that we want to note is that, you know, we don't want to encourage, and we're not suggesting that people are so rigid and inflexible that, you know, at the end of the day, when sometimes it's just the right thing to do, you don't do it because maybe it doesn't fit your criteria or it's not within your framework. You know, sometimes it's just the right thing to do. So there's always that balance with social accountability efforts of being strategic, but also, you know, that goodwill. Sometimes there's just some things to do. So why external partnerships with social accountability? You know, and I put this in here because I think too often people tend to just focus on the charity care component. So, well, you know, we have this many people that, you know, we support and we continue to take care of them, although their funds have run out, and this and that. And that's noble and that's great, and that is definitely something that's part of telling your story. But when we think about social accountability, we not only need to be thinking certainly internally about our mission fulfillment and responsibility there, but also the external piece and the extension of the mission above and beyond bricks and mortar. And I know many of you today who are on this webinar are largely CCRC attendees and taking a look at the registration list. So, you know, external partnerships, you're hearing partnerships, collaboratives, engagement in the community. As we all know, that there are many, many different terms that are used. And I'm actually sitting here looking at, I've got 5 different social accountability reports sitting on my table, and they're all titled something a little bit differently. You know, one's the report to the community, others engagement with the community, and the other one's social accountability report. So, again, all meaning the same thing. The one thing I will want to note, if there's any attorneys online, you know, when your legal team starts to hear the word partnership, yeah, the hair on the back of their neck stands up. You need to be careful. There is a legal aspect of the term partnership, and many of you may be nodding your head with that. So, yeah, if for some reason you have an actual formal agreement, you need to be careful with the terminology that you use. We've actually had some organizations that have partnered together, and the written agreement was collaborative all throughout as opposed to partnership, because it means a completely different legal entity and things. So just something to be aware of with that. You know, partnerships definitely are a key piece of social accountability, but probably more than any other aspect of social accountability, you know, that has its tentacles into other trends, you know, is the partnership element as it relates to healthcare reform. So, you know, I just have one slide here that talks about it being really, it's more, partnerships do bring you more than just social accountability. The purpose today is largely focused on social accountability, but, you know, you can knock out, you know, 2 or 3 birds with one stone here. So, you know, examples can be clearly collaborative work to address community needs. So, you know, if there's a prescription shortage for low-income seniors in your community, you know, you could be collaborating with some local pharmacies or a pharmaceutical company or social service agency to meet that need. You know, and there could be partnerships fostered not necessarily even through joint work, but also you identifying a need and a gap and you being the connector in the community. There's a lot of value in that. clearly, partnerships allow you to have others tell your story. Our last webinar was on internal and external messaging. So there's nothing better than having other people toot your horn. One of the best examples, and some of you may have heard this previously, is we've had Masonic Villages of Pennsylvania on our webinars before, and Joe Murphy, their CEO, tells a story of actually being at a local town council meeting, and they were looking for expansions and needed to have some approval locally, and there were some local communities or community residents who were questioning, they're a rather large CCRC where they're headquartered here in Pennsylvania, and without prompting, one of the council members in town held up their annual social accountability report and said, hey, do you know everything that they do? So, nobody from Masonic Villages even had to stand up. They had other people telling their story, which was wonderful. And you are in complete control right now to have people tell that story in a good way or not so good way. So get the word out there and have others pass along the good work. One of the things clearly that needs to be evident to everyone is that at a local level, if you have some close partners, whether it's elected officials, you do a lot of work in partnership with the Rotary, collect eyeglasses with the Lions Club, whatever it may be, you're clearly are going to be less likely to be challenged if a local issue comes up for approval for expansion or a new building. If you already have those close relationships and people know you, they're going to be less likely to question your not-for-profit status. In most of those local jurisdictions, it's somebody who, you're an unknown to them and you don't have those partnerships. So definitely something to think about. The final bullet that I have there is the Social Accountability Committee. This is something that we highlight more on the toolkit, and when we release that, we can dig into that further. And I don't know how many of you internally have a Social Accountability Committee. Something that very strongly recommend you consider, and not just made up of internal stakeholders and individuals, but some external representatives as well. And there can be some clear community partners on there, even outside of people who may sit on your board. So, it's more than social accountability. You've got healthcare reform, ACOs. Clearly, that's just a whole network of partnerships. Population health management, that's all you're hearing about, and a big part of healthcare reform. Cannot do that alone. Even the hospitals and health systems, even if they gobble up every nursing home, every home community-based service operation, every private practitioner's office, they will not be able to effectively manage population health on their own. So, schools are focusing on health and wellness these days, churches with screenings. Again, it's above and beyond just the social accountability. And the increase in home and community-based services, obviously, there's a partnership element to that, too. So potential community partners, this list could be in the hundreds, but I put this out there because I think generally, particularly now because of healthcare reform, people think of, okay, hospitals. And certainly they are one aspect of it, and there's a lot happening with community benefit with hospitals, and I have a subsequent slide where I talk about that a little bit. But clearly they're a player, but public health, grandparents raising grandchildren committee. There's different nonprofits out there focusing on these issues. YWCA, community centers, area agency on aging. How many of you have gotten together in your local community with everybody who even just focuses on aging and come up with some type of a master planning document? So it's yourself, area agency on aging, home health agencies, all of those different groups. The schools, the United Ways, churches. Yes, I have Walmart in there. People tend to chuckle when they see that and think, what? But I got to tell you, there are a lot of organizations that are increasingly partnering with Walmart. If you ever have the opportunity to check out the Vice President of Health and Wellness with Walmart, he's a pretty captivating individual. So small businesses, law enforcement, parks and rec. So those are just a couple examples of potential community partners. The other reason I put Walmart in there is because I want to bring up the whole for-profit, not-for-profit piece. I think generally as not-for-profits tend to think, well, let's align and partner with other not-for-profits. Oh, no, we can't, partnering with the for-profits doesn't make sense. Well, you know what? I think when there's mission alignment and when it makes mission sense, I think that is something to think about. I think that that's something real to discuss within your committee, executive management, and at the board level. It might make strategic sense and maybe even financial sense if it's, something even outside of social accountability, but it may not make mission sense. So that's a question to ask yourself. This is just 7 key points. And this comes from James Olson, the Collaboration Challenge, How Nonprofits and Businesses Exceed Through Strategic Alliances. And these are just some fundamental elements to keep in mind. You want to set yourself up to succeed. You don't want this to be a quick failure where you think, oh gosh, we didn't think through that. But you need to have that connection. Is there alignment with purpose? So that's where I want you to think strategically and not just, okay, yeah, they can be another partner. We can add them to the list because we want to make sure we have a really long list in our annual report. If it doesn't make sense, and there's not a clear purpose that runs across both your organization's missions and values, then it may not be a fit with your social accountability program. So what value does it produce for your community? Again, community thinking externally, greater neighborhood, effective communication, obviously, between partners. And I think if you've got a solid social accountability plan, you should have all of those communication aspects really laid out in there. Obviously, it's continuous learning. I think one of the things that we need to really emphasize is that constant, quality improvement with our social accountability programs. I could ask all of you now, how many of you have, social accountability programs or are doing things just because you've always done that? Well, we've always supported the Relay for Life here, and well, I don't know, we just continue to do it. So, when do you ask questions and say, okay, are we constantly, learning to either, assess whether it's producing the outcomes that we want it to produce, or is it, does it continue to be aligned with our social accountability mission? And then obviously a long-term commitment involving deep relationships. So the 7 C's to keep in mind. My final slides here is to get you thinking strategically. Now, this slide goes over just some basic points. The next 2 slides, I believe I have 2 slides, definitely get a little heavier, and I'm only throwing those things out for you because I want you to get in the strategic mode and really be thinking about, okay, how do I approach this and assess who's the best fit for me? So, so I'll go through this slide, and then I will do initial explanation before I advance to the next slide. So as I said, more is not always better, and there's a challenge with that a little bit in that you think, well, I'm supposed to quantify all of this and track all of these, social accountability efforts, and we know that, gosh, the more we can equate from a dollar amount that we give, the better. And there's no doubt that that's true, but I can also tell you that particularly when we look at the hospitals and what is happening there, there is very much a pressure to take a look at, from a federal level, not just throwing money at something. Oh, okay, yeah, we'll support, the American Cancer Society's, gala tonight, or we'll give money to the mission. It is being strategic about it. For those of you who are not aware, hospitals are currently, the not-for-profit hospitals, I should say, are really increasingly regulated around their community benefit, and there are more and more mandates. Healthcare reform has required that every tax-exempt hospital in this country, now think about those that are in your neighborhood because they're potential partners for some of this work, every tax-exempt hospital in the country must conduct a community health needs assessment every 3 years. And there's very detailed reporting that includes identifying community needs and what partners will you engage. So if for some reason one of the hospital needs assessments identifies an issue around aging or seniors or maybe transitions in care, you need to be at that table. So find out what is happening in your backyard with that. So like I said, a great deal of reporting, and one of the requirements that the hospitals have to do is that they must do the needs assessment collaboratively, and they must share the results. They must post it publicly. So just good to know what is happening in that arena. Back to the slide here, focusing on mission alignment. Again, what are your criteria? Have you established criteria for what is a good fit for you? I know a lot of organizations are doing that now in terms of, some of you are being approached on a pretty regular basis in terms of, any potential affiliations and, some organizations that are wanting to maybe join your organization. And, I know a number of you have some really clear criteria as to what is a fit for you. So, and then, is the partnership a way to jointly address a community need? I had identified that too. And then, participate in a community-driven needs assessment. As I said, there's a lot of these that are happening, and it's important to be at the table and know what's happening, because chances are the hospitals are forming some big community-wide partnerships to do that work. I mentioned the for-profits. Here's the question that I want to ask yourself. Do you know how the organization or your, if it's a retirement community, is perceived in the community as a potential partner? So you may think, okay, yeah, great, I want all of these partners, but yet they may not want you as a partner. Have there been issues lately in the press? Are there any concerns and things that need to be done to maybe mend and foster certain relationships? Again, goals to deepen the relationship between beyond simple donations or a one-time event. So in terms of just some assessment thing, we have the research minds here at Holleran, and we want you to be thinking a little bit in this way. But obviously, community needs assessments are increasingly becoming a part of social accountability programs. So, I spoke with a provider, a CCRC organization the other week, and they said, you know what, we've been doing social accountability and have a pretty good program. I've been doing it for a number of years, but yet, I don't know how strategic we are with what we do and what we don't do. For example, we do, collect money every year. I have a big campaign around, I think it was something around breast cancer donations, and they said, it's great, and it's been really wonderful for us, but we think, God, if that's, what we should really be doing. Of all of the things and all the needs in this community, we know that there is an issue with seniors in our neighborhoods that are not getting, 3 meals in a day or lonely and isolated. So, it's a matter of, prioritizing in that sense. So, again, community needs assessments are going to play a big part in partnership development and thinking strategically about social accountability. Considering, how do you do some type of a partnership assessment? So, again, understanding how key community groups view your organization. That can always be done through, a mini type of survey. I know different groups are doing that. An autopsy of what past successes and failures have been with partnerships, and where is their potential mission and value alignment. Partner perspective, partner mapping. There can be visual maps created of prospective partners. Now, these are the next few slides, and like I said, it's going to get a little heavy, and I'm only doing this to show where some organizations' heads are, because you think, oh my gosh, there's dozens of potential partners in our backyard. How do we sort of pick and choose and think, okay, who aligns here and there outside of partnerships through maybe a service line development? So I'm going to very quickly just put these out here to you. I'm not going to go in depth with them, and for some of you, your eyes may be rolling in the back of your head and thinking, oh my gosh, but a lot of this is around network analysis concepts and social network analysis, but basically you can create visual depictions of relationships and connectivity. So I'm going to go through these quickly. For example, you can, again, have partners mapped all throughout. So it may be businesses, law enforcement, housing, whoever it may be, and you're in the middle, so who are you connected to? So you might find that you're not really directly connected to the hospital, but you're connected to them through another group or agency. Or you might want to highlight some of these diagrams in certain colors of everybody in yellow are the ones that are senior living specific focused. All of the others, or maybe government agencies or whatever it may be. So there's different ways that you can create these diagrams and to identify the strength of the relationship. So, if there's somebody out there and they're a potential partner, but you really have no contact with them, they're not going to have a line between you and them, but they may have a line with one of your other partners. So This is a very scientific way to go into this. There are whole books written about things like this, but the bottom line is just to have you thinking again about the the networks and potential ways to think strategically about that. So I'm going to end there. Some of you are thinking, what did I get into? I promise we won't go any deeper into this. So what I'm going to do at this point, excuse me, is I'm actually, and you know what, I'm having, sorry about that, I'm going to pull my PowerPoint back up. I want to introduce Scott Miller, and he is the Director of Marketing with Garden Spot Village. And Garden Spot Village, he can give a little bit more background, but Garden Spot Village is located here in our backyard in Pennsylvania, and Scott has been with them since March of 2005, so just celebrated an anniversary. And as I was talking with Scott, we were talking a little bit about the ownership of social accountability. And I said, so who, are you sort of the owner and the champion of that? And he said, actually, that's really the senior management team owns it. And clearly, he plays a role in terms of the community partnerships and fostering a number of them and telling their story. But so, pleased to have Scott here with us today. And Scott, I believe you should have control of the keyboard at this point. If not, let me know. But there you go. I see you're moving all around. So Scott, I'm going to turn it over to you.
Okay, thank you.
We just need you to unmute. Okay.
Okay. Can you hear me okay?
Yeah. You're good.
All righty. Well, thank you for inviting us to participate today. And, it's just an honor for us to be able to talk about some of the things that are happening. And obviously, if anyone has any questions or anything, please feel free to call or email afterwards. Let's see if I can advance the slides here. It looks like the control is bouncing back and forth between the two of us, Lisa. Because at the moment I can't change the slides. There we go. To give you some background on Garden Spot Village is a retirement community. We're in New Holland, Pennsylvania. We have a 104-acre campus. We just celebrated our 15th year last year. We have just under 1,000 residents. When you look at the residential and the healthcare offerings that we have 542 houses and apartments. And then we also have adult-based services. We offer Garden Spot Village at Home. We have memory support, personal care, and skilled nursing. About 82% of the people that live here are in residential living, and so just under 20% take advantage of health care in one way or another. We have been, for the last several years, working to attract baby boomers, and so we've had baby boomers begin to move in. We have a fair number of people that are in their 60s. I believe our youngest resident is currently 57 or 58, and their spouse is 62, and so that brings some vitality and some energy into the things that we do. Garden Spot Village was the initial organization. You can see also there are two other sites listed on here. Maple Farm, Garden Spot Village purchased Maple Farm several years ago. That is a skilled nursing center in Akron, and we've been converting that to our household model of skilled care, which I'll talk a little bit about as we move along. And then the press building will be a 55-plus offering in downtown Lancaster on the corners of North Prince and West Lemon Street. There will be 44 urban lofts in that building, anywhere from about 1,300 to 1,600 square feet, and that's really sort of a cool urban setting. One of the things that Lisa was talking about was partnering up with for-profit organizations and looking at, how do you determine who your partners are going to be, who do you get involved with, how do you do that? One of the things that we do, as Lisa had mentioned, people approach us about being partners all the time, and so we typically evaluate partnerships against our mission statement. We have a tendency to evaluate just everything that we do against our mission statement, which is to enrich the lives of older adults as an expression of Christ's love. And so that is our first criteria. And then we also measure against our strategic objectives, which we typically have 5, so we see if they fit into the strategic objectives and then our core values as well. A number of years ago, we had established one of our strategic objectives was to look at, beyond New Holland to Lancaster City to see if we could extend our mission and make any offerings in that area. Interestingly enough, shortly after that, we were approached by the Lancaster Press Partners, which is a for-profit development organization, who came to us and said, we were looking at developing this building in downtown Lancaster. Would you be interested in partnering with us and potentially offering some sort of retirement living or 55-plus living in that environment? And so in that particular situation, we partnered up with a for-profit organization. And so those opportunities are out there and available. Thinking about social accountability and how it pertains to the things that happen here, Gardenstar Village, we're a 501c3 nonprofit, and Lisa had mentioned community benefit, civic engagement. We like to think in those terms. Dale Weaver and Victor Weaver, who were the original founders of Gardenstar Village, since we're only 15 years old, they are still very prominent in everything that we think and that we do. Dale Weaver, one of the founders, lived at Garden Spot Village for approximately 12 years. He was also on the board served as the chairman of the board and was participated in the board. And one of the things that Dale always asked the question of, and sort of how Garden Spot Village started out, which was he always posed the question, how can we be a good neighbor? How can we make sure that we integrate into the larger community, that we're just not an island to ourselves here on our campus, but how can we integrate into the larger community? How can we make an impact? How can we reach out? And so I think one of the things that is fortunate from that sort of a mindset, of that sort of a focus, is that social accountability, community benefit has really been woven into the fabric of our culture. And so we pay attention to that. About 4 or 5 years ago, we created a matrix to take a look at all of the different things that we were involved with. It was sort of, when Lisa presented the partnership map a while ago, that was sort of what it reminded me of, but we created it in a matrix form to take a look at all the different places we had been involved. And at that point, there were like 5 or 6 pages of a spreadsheet that were attached to that. And so there was a fair amount that we were involved with. And we sort of took a look at that for a couple of years, and then when I guess it was at either a Leading Age or Leading Age PA, some of us had attended some sessions on social accountability, and seeing with the level of responsibility that the hospitals are being held to, we thought that we better pay more attention to it. So in the last, I'd say probably 24 months, the last 2 years, we've become much more intentional about who we partner with and how we do it and how we reach out. Approximately a year ago, we purchased the licenses for the Lion software so that we could begin to track that online and get a better sense of what we're doing. I was actually very excited to hear that Holleran has a toolkit that they're coming out with, because I think that we're going to be asked to do more and more of that, and so I think it's just a very good thing to be involved with. The other part of really having all of this woven into the fabric of our culture is that we do obviously come from a faith tradition, and so mission and service is a part of who we are as well. Taking a look in general at where we participate, and some of this has just evolved. I don't think that we could sit down and say, oh, we intentionally decided to have national impact or global impact on the things that we do, although some of that has taken place over the last several years. We always wanted to be involved very locally in New Holland and Lancaster County. Garden Spot Village produces a magazine, and you can see it there on the left-hand side. It's called Destination Garden Spot Village. We produce that twice a year. This particular issue was, I believe this was last fall of last year, and this was our social responsibility issue, and you can see some of the things that are mentioned right there on the cover. Making music in Lancaster City in conjunction with the Lancaster Press Building. We signed up for a number of cash sponsorships that we do, so we just we just do cash-based sponsorships to a variety of different organizations that fall within the context of the mission and seem like, good things for us to support. And so we've been working to support the city in downtown Lancaster. That would be locally. You see there in the bottom left, it says on patrol, volunteering at the New Holland Police Department. We encourage residents to be volunteered in a lot of different things. The New Holland Police Department was looking for some extra help. They came to our volunteer services, and we began to connect some of our residents with the police department, who now serve as their receptionists and greeters in a variety of different scenarios. And so that has worked out well for us in just in terms of the local support. And then you see Operation Intern, where it says we go international. We are collaborating with MCC in their IVEP program, which is also mentioned in some slides a little bit later on, but we host interns from around the world and have them come to Garden Spot Village and serve here and learn about what takes place here. And they bring a lot of really great information and skills to us in terms of their partnership and their participation here. As we look locally, Garden Spot Village encourages both people that are on the management team and that are on the front line to participate in a variety of different organizations. And that's sort of how we find some of the things that we get involved with. We're members of the Chamber of Commerce. A variety of us serve on different nonprofit boards. We participate in the business association, clubs, churches, probably the same types of things that many of you do. As we look at that, we look for opportunities and ways to be involved and open up discussions and get into dialogues with ways that we can be a part of and support the community. If you look at some of the bullets here, I'm not going to walk through every one of these bullets. There's a lot of them here, but I'll just make a couple of comments. If you look over on the top over here where I'm pointing with the cursor right now, those are some of the dollars that get invested. And sort of like Lisa said, we view those dollars as that's sort of like table stakes. Everybody just simply expects us, because we're a continuing care retirement community, to provide uncompensated health care. Last year it was around $1.4 million, and this year it's probably going to be closer to 1.9. But that's, people just expect that. So if we go out and say, well, we do this as a social accountability thing, it's like, well, that's what you should be doing. We provide, millions of dollars in wages to people. The people that live at Garden Spot Village spend a tremendous amount of money in the local community. Those are all things that take place. One of the big issues these days is taxes and whether or not retirement communities pay taxes. A number of retirement communities have been applying for tax exemption. We have decided that we want to continue to pay our taxes. We're in pilot programs. We want to continue to pay the taxes because we expect that the townships are going to be there to support our building projects, as Lisa had mentioned. We expect the police to be available if we need any sort of support services. The EMTs, the fire departments, we work very closely with the fire departments and some of the big events and things that we do. And so we just feel it's, from our perspective, that we want to pay those taxes to maintain the good relationships and because we expect services from the different organizations and civil service organizations. A couple of things that I'll point out on this whole list of different things that we do locally. One is, this is actually a typo, it should be Elanco Social Services. There's a logo over on the top here that you can see this. That was a group of churches and local organizations that wanted to get together to provide social services. We have a farmhouse at the end of our campus, and as those discussions got taking place, we offered our farmhouse as the place for them to house those. And so we're in partnership with that organization right now. They're here on our property, and we provide the property and the maintenance and all those types of things at no charge to them as a way to outreach into the local community. Making a difference is also something that I would highlight. One of our staff members was on a trip to visit their son and daughter who are missionaries overseas, and on the way back, flying for 13 hours, whatever it was, read a book about making a difference in your local community. And so about 3 years ago, she spearheaded an effort to create this program called Making a Difference, whereby we partner with a different local charity every month to provide service to there. So whether it's collecting clothing or it's to provide things for the school students if they need school supplies or collecting for Salvation Army. But we made that very intentional, and we rotate that on a monthly basis. We do that involve not only the staff, but the residents as well. Some of the other
how
things
do you determine what you select month to month?
For the Making a Difference program, there is a committee that is involved with that. And so Colleen Musselman, who is the director of our Life Enrichment program, was actually the one of her services, is the one who had the idea. She leads that committee, and then the residents and her take a look at the different opportunities and select them that way.
Oh.
And so it's committee based, and it's worked out very, very well.
Great.
And a lot of times then we'll invite them to come into our town meetings and present and get greater involvement there as well. So that's kind of neat.
Okay, thank you.
You can see Pedal to Preserve. It says the events. You can see on the right-hand side there, Gardensville Village hosts a marathon. And just this year, this was our 4th year for the marathon. And just this year, Steve Lindsay was talking to the mayor of New Holland, who made the comment that said, you know what? He said, wow, that marathon really brings a lot of business into the area. He says, I went out to get something to eat. I couldn't find a restaurant to eat in because everything was so full. So we fill up the bed and breakfast. We fill up the local hotels. And so it's just a good event overall for the community. And the community recognizes that. Pedal to Preserve, that is a relationship with Farmland Trust. And they do a bike ride every year to raise money for what they do. And we host that here on our campus. Our Director of Campus Services is part of their planning committee, and so we host that at no charge to them. And you know, we wind up investing because we have staff that provide the the services and the things that go along, and so it's just another way for us to reach out. On a national level, a number of years ago, Garden Spot Village began with our household model of skilled nursing, where we transitioned to a person-centered type of care away from the institutionalized model. As a result of that, we have had hundreds of organizations from all across the United States come and visit us, literally thousands and thousands of people. And you look at something like that, it takes a tremendous amount of staff time for us to host all of those folks. And typically, it involves not only the line staff, but a lot of the management team as well as people come in, because when people come for those tours, they're anywhere from 2 to 4 to 6 hours. We set up some sessions where people could come and stay overnight and spend a couple of days with us. And so we're doing our best to provide, what we do, that other people can take a look at that and, determine what makes sense for them out of that as well. We speak at the different conferences. I think the thing, again, probably all of you do that type of thing. We also try to provide the ability for our frontline staff. You'll see the Pioneer Network there. Our frontline staff will go and present at the Pioneer Network because they are the ones, especially in the household, who are there and working with people, and they know what's going on, and so we provide the opportunities for them to go and do that. I was talking to someone from another nonprofit just the other day who said that the only way they can go to a conference is if they sign up for the conference themselves and they pay for the plane ticket. But we try to support reaching out into the community and providing that. If you look on the pictures on the right-hand side here, this is the Partnership Home Program. In 2010, we partnered up with the Mennonite Disaster Relief, and the residents, local churches, local community members got together, built a house here on campus, and then after it was built, it was dismantled. You can see it was loaded on a tractor trailer there and sent to Louisiana, and then we sent work crews to Louisiana for about, I think, between 6 and 12 weeks to build that house, which was then turned over to a family that had lost their house in one of the hurricanes. We have plans to do that again this year in 2012, and we'll be building a house for someone in Texas. And so those are some of the things that we do that just reach out on a wider basis. I also have a bullet here about participating in summits. You can see the ones that we participate in there. So again, the organization supports getting involved at a lot of different ways. This is almost my last slide, so I'm about ready to wrap it up here. We have on an international or a global basis I mentioned the households and some of the work that we've done there, and we host organizations. Also, organizations have sent delegations from a variety of places around the world, Canada, Mexico, Ireland, the UK, China, who have come to spend some time with us to see, what we're doing with skilled nursing and how we do it and how we've transitioned that to more of a home-based model as opposed to a hospital type of model. I mentioned the IVEP program where we host interns for 6 months. We've had students come from Kenya and Cambodia and India. We also encourage mission trips. We've sent two groups of people to Honduras, to a camp in Honduras. These two folks right here that you can see I'm pointing to are residents at Garden Spot Village, and so they organize trips down to that camp. So that's how it ties into Garden Spot Village. These over here are filters, and there is a person that lives here at Garden Spot Village who actually has a worldwide business to distribute these filters to provide clean water to third world countries. And then these are some missionaries that live here at Garden Spot Village that still travel to China twice a year to teach English. Casal is one of our IVEP students. And so it's just a variety of ways that we try to reach out and support not only locally, nationally, internationally, different things that are going on. I think that one of the things that Lisa said earlier is that I think probably our best strategic objective is that we just try to do the right things. And if you try to do the right things, opportunities have a tendency to come to you that make sense for your organization and the things that you do. There's our mission statement, our core values, and again, we measure the things that we do against those as well. And that's pretty much the things that I had thought about. So, Lisa, I'll turn it back to you.
Great. Thank you, Scott. I appreciate that very much. And great examples. And I know, again, one of the things that we hear is that it's always helpful to see examples. And, there's so many different opportunities for collaboration to, as I gave examples of, a community partnering with the Rotary to do, chores for senior homeowners, delivering groceries to seniors, heard of bookmobiles, partnering with maybe a county to get books out to seniors, supporting a local shelter for daily lunches for seniors. So the reality is you need to be aware of what the needs are in your greater community and also be very clear on what your resource sources and assets are. If there can be some needs out there and you may not be the one best positioned to address it. So, but there might be a partner that you could do it with jointly, or again, you might just be the convener, as I had mentioned previously. So, thank you again, Scott, for that. In terms of moving on, all of you can see here, I'll spend a second here, there is contact information for Scott if you wanted to follow up and ask any specific questions of him about their organization. What I'm going to do, I actually have questions and discussion next, but before I do that, I want to talk briefly about the toolkit, give all of you a heads up, and then I will look in the question pane to see if anyone had submitted any questions. But we've been talking about this for several months now, and we will be releasing next week in DC at the Leading Age Peak Conference, Holleran Social Accountability Toolkit. So for any of you who will be in attendance there, certainly seek us out and we can give you some information about that. It will be free to senior living providers. It is going to be a web-based toolkit. I say with a lot of confidence and with excitement that it's very different than other documents that have been out there. It's not just a philosophical guide of why you should be doing it and all of that, but it gives you very clear tools and guidelines and a model to how to approach social accountability. We have self-assessments on there that are free. You can go in and then it spits out an instant profile of your organization and where maybe you're weak and where you're a little stronger with your social accountability. So we break it down into a really, it's somewhat easy to understand 5-phase model for you. So we're really excited to release that for all of you. So please stay tuned for that. Like I said, next week at the Peak Conference, but then you'll be hearing some promotions through Leading Age. We also plan to do a webinar to walk people through the toolkit. The intent is really to have all of you educated and equipped with what you need. I had referenced earlier the Social Accountability Committee. For those of you who do not have one and are considering one of the things that we have in the toolkit is the whole rules and responsibilities of a committee. So if you are looking to put one together, essentially an overview of what that committee is charged with, who to consider putting on it. Do you make it a subcommittee of the board, or do you have it as a separate committee with a board liaison? It outlines all the pros and cons of all of that. So very excited to get that out to all of you. If we do have a number of people who are on our waiting list already for that, because we'll be doing an email blast. If you definitely want to receive the information on that, have here on this slide, Ashley Greenwald, you can email her, and we can make sure that you are added to that list. So that will be the next webinar, and we do not have the date scheduled for that yet, but we will be sure to let everybody know when we do. So in terms of questions, we have one question here, and I believe it's for you, Scott, because it says he. Is he saying that they voluntarily pay taxes to the city when they are exempt? Scott, can you clarify about the taxes?
We have not. Let's see, how do I put this? There has been legislation that says that retirement communities, CCRCs, can apply for taxes, for real estate tax exemption, and at Garden Spot Village, we are in a pilot program with our local township and the school board, where we pay a significant portion of the real estate tax. And so even though we could go for tax exemption and apply for that, we choose specifically not to do that at this point.
Yeah, and I know that that's a common practice. For those of you who do not have pilot agreements locally, I would encourage you to consider that. I know we've seen a number of examples of organizations that have gotten dinged a little bit where, this is what we could be getting, but, we don't, and so it can lead to some really uncomfortable situations out in the public. So the pilot agreements are a common one.
Yeah, pilot actually, the word pilot stands for payment in lieu of taxes.
Yes. And that's actually something that not just CCRCs are looking at. I know that I had a discussion the other day with a group of hospitals, colleges. By the way, if you're looking for a partner, colleges are under the gun too with the federal government. So, if you take a look at any of the taglines and promotions recently for colleges, a lot of them are adding taglines around, community, engaged, and things like that. So, quite frankly, I'm actually speaking at the Ziegler CFO conference later on this week, and I ended with what the good news is. So the good news is that colleges are sort of ahead of CCRCs in terms of the scrutiny a little bit. So it's hospitals, colleges, and then some of the senior living folks. But we did get another question here, but I believe that this is directed to me. Are you willing to share your social accountability publication? Have looked on your website and not finding it. And you haven't found it because it's not there yet. So, yeah, we will be sharing it with everyone. And, again, it's going to be a free document that you will have to log on and access, and it's an interactive PDF document that you can take a look at. So it will be released next week. And the other thing that I didn't mention that this question has prompted is that we actually are creating, when we launch this toolkit, we have created an entirely another section on our website which is just devoted to social accountability. So in that, the toolkit will be housed in there. We've got PowerPoint templates that people can use if you need to present maybe to your board and introduce them to social accountability or to other groups. Template that you can customize to your organization or community name. All of the webinars will be housed in that. So coming next week, you will all receive links to that, and that will be promoted so where you can go and find the toolkit as long, in addition to others. We plan to evolve that and potentially even have some areas where you can post questions and have it be interactive. We will give sample social accountability reports, so a number of different things like that. Don't know if there's other questions. Our state has recently done away with the estate tax, and our town will never lose, will lose over $1 million per year. Is this common in other states? Our city is hopeful to see some contributions by seniors, as a result of this lost revenue. So I'm not familiar with the state issues around the state tax and towns losing significant amounts of money, but I can tell you, and certainly if others have stories to share around that, you can put that in the box. But one of the things that I do know is that local governments are clearly, looking for money, and not just local, but state. So it's again demonstrating that benefit in the greater community. So a lot of local governments are looking at all of these not-for-profits in their area, and particularly if there's a large number of not-for-profits that maybe there aren't any type of agreements and they're seeing this potential money loss, they're looking to recoup that somewhere. So, a lot of this is just really a sign of the times, too, of where we are. I'm not currently seeing any other questions at this point. So certainly we have all of our email there. You can email myself if you have other questions, or Scott, anything specific to him. But, I believe at this point, then, Scott, if you don't have anything else to add, we will adjourn. We appreciate everybody's time. We hope this is helpful. And next time we'll be talking will be about the toolkit. So definitely keep your eyes and ears open for that. And I look forward to hearing your feedback on that as well. All right. Thank you, everybody. You have a great day.
Bye now.
Thanks, Scott. Good job.
Hello. So you turned it off?